Hey everybody, it's Eric with MotionGuidance, and thank you for joining me today. The topic is involving the trunk and the midsection of the body, and this is part of our Healthy at Home series that we've put out as a line with our patient pack models that you can find at www.motionguidance.com. So with the trunk and the core pack, you're going to have this type of flag. You're going to have a belt. That's a large size belt. You're going to have a perpendicular mount with the clips on the back that go into the blue field, and then you're going to have your red laser that you can see showing up there. All right, so what I want to go through with you today is two options in standing and two options in the quadruped position, just for general back health and range of motion activities. You might want to use these if you're experiencing back pain, stiffness, if you're recovering from an injury, or if you just want to maintain a healthy position on your back by keeping it moving and doing some light trunk work. Okay. Now, as always, we recommend that if you are experiencing some difficulty, that you consult your local healthcare provider, but otherwise, give these a shot. All right, so let's start with the belt. Let's open this thing up. Let's put that blue field facing in toward my body, and I'm going to wrap it around where a typical belt would go on the front of my pelvis here. It's a floss through design on the buckle, so I can push that through, fold it back, and then that should actually position the blue field toward the front of my body. All right. Then I can take this perpendicular mount, which has these teeth on the back of it. I can slide those teeth into the blue field, tilt the laser to the side, and then roll that onto the top of the ball and socket joint. So let's get started with this first exercise. This is general motion for the lower back, which is super healthy to have motion. In fact, a lot of people that have pain stop moving their lower back either out of fear or maybe a loss of awareness of what their body's doing and potential muscle spasm. And so I'm going to face the flag. I'll be off center here so that you can see. But I'm just going to assume what I think is my typical standing posture and then turn the laser on, and then I'm going to move that laser up toward the center target on the flag here. What I want to do is, and hands on hips is acceptable, or you can just have your hands by your side, is I'm going to try to move that laser up toward the top target without moving my shoulders. Okay? And then I can move that laser down toward the bottom target without trying to move my shoulders. In clinical terms, we call this a pelvic tilt. Okay? And from the side, it'll look like this. All right? Just trying to move the pelvis forward and then backward. Some people like to think about the tailbone lifting up, which is a forward pelvic tilt, or the tailbone moving down, which is a posterior pelvic tilt or a backward pelvic tilt. And you can use the laser to encourage yourself on motion. So how high can I make that laser go? How far down can I make that laser go? And do repetitions of that. Okay? Up and down. Nothing wrong with going through several repetitions there. If the endpoints hurt and they're getting worse, the more you do, you can just stop and work inside that comfortable range. Okay? If they feel okay, you can go through as far of an in range. Like here, I can really try to tighten my abdominals and get that pelvis to get all the way up to the top of the flag. All right? So that's going to be just moving the laser up and down with my pelvis.